Well, good afternoon, everybody. Welcome to the December edition of the Better Together webinar hosted by PlanRVA. We are so excited to round out our first year of hosting these online webinars with a really exciting program today. Just a little bit of background for everybody who might be tuning in for the first time. We launched this series last November in 2020, really to be able to create a new way for us to shine a light on the great work that's happening in the region and tell the story of collaboration in its many, many forms across the Richmond metro region. So I am just so excited today to be able to introduce a friend and a colleague in Abby Rogers from the YMCA of Greater Richmond. She's put together a really great team of community members and community leaders, and I assume probably friends as well, since they agreed to participate in our webinar, to talk to us about a really exciting collaboration that's emerging here in the Richmond region. So Abby, I'm going to turn it over to you to do an introduction and tell us a little bit about the YMCA, and then we'll get started with our program.
Yeah, thank you so much. It's interesting when you start to talk about the YMCA. I feel like so many people that we meet and get to talk to have a Y story, right? Did you learn to swim at the Y when you were a kid? Did you go to Y guides or Y Indian guides, as it used to be called, as you go? Or, maybe you're a member now and your kids are playing youth sports at the Y. But there's so many different opportunities that we have in the community to engage. And we love that everybody has their own place where they fit into our organization. But I think sometimes because of that wide variety, the larger picture of who and what we are in the community gets lost. And so, Martha, thank you so much for the opportunity just to give a little bit of an overview about what we're doing and how we got here to this conversation today with these amazing partners we have that are joining us. The Y is for healthy living, youth development, and social responsibility, and that covers a lot of ground. But what we really see ourselves is an opportunity to help partner with other groups to strengthen the foundations of our community. And so that's what we do, as our mission is to put Christian principles into practice through programs that build a healthy spirit, mind, and body for all. It really is a vast opportunity we have to engage in different ways. And though we know we can't do all things and be all things to all people, we can help connect dots with other partners. And that's really where and how we find ourselves today in this conversation. Everybody has been through a really incredible last 2 years. It's hard to believe that we're coming up almost on exactly 24 months in this COVID world that we're living in. But what that did here in our community, and I think in a lot of communities across the world, was expose what we knew were issues that became really much more visible and drastic during this pandemic. And that really is about health equity and the opportunities that everybody in our community has to engage in living that healthy lifestyle and being able to have access to things that create health equity in our communities. And for the Y, it really showed us a different and better way, I think, to be able to do this work. And so that's what we've been engaging in partnership with a lot of different organizations. We have 2 of our main partners with us today to talk about what our Help PlanRVA program is and how we're helping people really access that health equity here in our community as we go forward. And we'll get to talk a lot more about the specifics as we go. But I do want to take the opportunity to introduce the 2 panelists that we have that are joining us to talk about what this partnership and collaboration has looked like that's been building over the last 20 months. And first, we have Cheryl Garland, who is the Chief Health Impact Officer at VCU Health Systems, and has been a great partner to the Y in many different ways over the last, probably 10 years, but really specifically in this work we're doing with Help PlanRVA. And then Amy Popovich, who is the Resource Center Program Manager at the Richmond City Health District, that really has helped brings to life some of the work that she's been doing in different communities that she serves.
Well, thank you so much, Abby, for that intro. I think it's interesting to think about how all of our organizations had to kind of pivot earlier this year, or over the last 2 years, really, and to think differently, dig deep a little bit about our own mission and purpose in the organization, but how we orient to others. And I can't think of two other great examples in the community of really time over time, really stepping into new and brave spaces to be able to serve our community. So Cheryl, I think we'll start with you. If you could just do an introduction of yourself, and then Amy, as soon as Cheryl's finished, we'll have you introduce yourself.
So thank you so much, Martha. And I want to first thank Abby for inviting me to be one of her partners in this conversation today, along with Amy. As Abby said, each of us has been working together for years on various projects. And so I'm so excited to be here to talk about the Help One RVA initiative. And as Abby mentioned, I am the Chief Health Impact Officer for VCU Health System, which, as many of you are probably aware, is the academic health center that is affiliated with Virginia Commonwealth University. What you may not know about us is that we are the largest safety net health system in the Commonwealth of Virginia. And truly embedded in our mission is to care for all who are seeking services. And my role in the organization has been to build programs and partnerships that are focused on improving the health of the communities that our health system and our health sciences schools and our university overall are serving, either from a patient care standpoint or an education standpoint, or just from an outreach standpoint. And so I'm excited to be here today to talk about how we have pivoted and tried to play different roles in different conversations to achieve a community goal.
Thanks so much for that, Cheryl. Amy, please introduce yourself and a little bit of background about the health district and your role there.
Sure, happy to. I was having internet trouble a minute ago, so please flag for me. I've got a backup device ready to go just in case.
Great.
So thanks. I'm the nurse manager for the Richmond Henrico Health Districts. We are two sister health districts joined together by a shared leadership team. And the core of our mission is really to expose and address root causes of health disparities. And Abby, you mentioned this already. We certainly have seen that in our COVID data, that, unfortunately, these disparities that we knew existed really came to light. So part of what we're doing is making sure we have the data to understand what that looks like, making sure we have the strategy to operationalize that, and that we're partnering with communities alongside to figure out collectively what the best strategy is to address things. So I think this is a great example of what that looks like, because we get to partner across sectors with the YMCA, with VCU, with our jurisdictional partners in Chesterfield, for example, really looking at the various layers and complexities that involve someone's life and supporting them in being the healthiest person they can be. So that's a little bit about us. Many of you all know we've been leading this pandemic response here for the last 18 months. So was very grateful to do this work in partnership because we didn't want to miss the opportunity to already start working on the things we were learning about in COVID while we were still in the middle of it. So also a thanks to Cheryl and Abby for their partnership in this work.
Well, thanks you all for that background. I think we'll dig into and just really kind of talk about Help One today. And my first question for you is, how does all this get started? Is it truly born out of the pandemic, or as you said, kind of the opportunity to be able to move a really crucial partnership for the community forward in light of the pandemic?
Yeah, I'll start, but then I'll pass it to Cheryl, because Cheryl's been working on this kind of work for a long time, to give a little bit of history about kind of what led to this, because it really didn't start in the pandemic. The pandemic really kind of exacerbated the issues and problems, but it really is about creating a shared resource where citizens can help discover for themselves where they can go to really get from having issues and problems they can't address to thriving as a family. And so we bring together all of the resources and create opportunities to connect people back to what is already there, to leverage opportunities, or just to clarify where those services might be. But Cheryl, you want to talk a little bit about the back history about what happened and then kind of how we got here, and then we can talk a little more specifically about the Help One RVA project.
Sure, and I may have to call in a friend or send out a lifeline to ask Amy to help me a little bit with this, because we've been on this journey together for over 5 years, and much longer, to be honest. But as Abby mentioned, about 5 years ago, or a little bit longer than that, several partners in the Richmond community agreed to participate in a federal initiative that was launched by the Centers for Medicare and Medicaid Innovation, which is truly the innovation arm of the Centers for Medicare and Medicaid Services, or CMS, that provides the oversight for the Medicare program and then guidance to states for the Medicaid program. And CMMI, or the Centers for Medicare and Medicaid Innovation, issued a call for proposals for communities to come together to really look at a research question. And the question was, what would happen if you identified and addressed health-related social needs for Medicaid and Medicare populations, and would identifying and addressing those issues have an impact on cost and utilization? And 30 communities across the country have agreed to participate in what's called the Accountable Health Communities, or AHC initiative. Richmond is one of them. And we were brought together by what's called the Bridge Organization, or Health Quality Innovators, which basically looked for healthcare providers such as the health department, health systems, federally qualified health centers, behavioral health providers, and then partnered us with community-based organizations to address 5 what are called social determinants of health related to housing instability, food insecurity, interpersonal violence, utility needs, and non-medical transportation. And for the past 4.5 years, we have been screening patients who come to all of the facility partners for these issues, and then putting that information in a database, and then helping many through either referrals or intensive navigation to get to community partners. The unfortunate part about this is it's being done in a database that's owned by the federal government. And we know that at the end of the initiative, which ends in early 2022, that the database will go away. And truly the initiative will go away. The federal government will have the data that it wants to answer the question that was raised. But the partners have really seen the importance of working together and making sure that we are doing exactly what you said, Abby, which is connecting individuals to resources when they come for healthcare. Because we all know that a very large percentage of the factors that drive health outcomes are really related to social determinants and economic issues that individuals are challenged with on a daily basis. And so when the discussion started about Help PlanRVA, it was a natural progression to continue the work that was started for this federal initiative to really then think about what's the sustainability of this important concept. Amy, did I miss anything?
I think you covered that really well. I think I would just add, even as a community, as we were looking to apply for AHC, it was because Accountable Health Communities. It was because we'd already had conversations about how do we support our community well. And we knew there was just a disjointed service, that no matter how many people we put in place to case manage, no matter how many health workers we have and social workers we have, if there was not an integrated system to communicate with each other and to be able to really make it easier for the residents to not have to tell their story over and over again, but to have a seamless approach, we sort of knew that that would be most effective. So I think we collectively as a community applied for AHC, knowing that that it could be better, that our work was good, but that it could be better and more coordinated for our community.
So, and then about the same time, the Y received a grant from the Richmond Memorial Health Foundation to really look at health equity questions and try to answer some questions about how do we solve some of those problems here. And so we had specifically picked the Hispanic Latino population, which is growing here in the area, to understand how do we help that particular community reach better health for their community, and a very broad definition of that. And what came out of that was the understanding that they really didn't understand or always know where to go to reach resources that already existed. And so we, at the same time, had started to work with the city of Richmond with a particular software system that they had in order to try to connect and hire navigators that were bilingual, that could work in that community, that would then help them navigate the systems that maybe they don't understand, or, there's lots of different housing nonprofits. Which one was going to solve their problem for them? That might be eviction versus rental help versus homelessness, but they don't know the difference in how to figure that out. And so how did we help facilitate that process for them to really create the opportunity to create stability in that community and do it? And as that was just starting to get off the ground, then COVID hit, and we really were able to bring these two efforts together and say, we're doing similar work, we're working side by side. We were working with the health district on our piece, they were working with VCU and other groups on theirs, and really combine these efforts to try to get after the best of all of it for the community, because the needs were growing as COVID happened. You know, the number one call we were getting through Help RVA was for housing, and it was from all across the region, from zip codes you wouldn't have expected it to. But this really was highlighting the fragility of some of the issues that we have in that economic stability that we have as a community. So as we brought this together, we've really been able to leverage all of these efforts and bring the best of all of our organizations in order to really support our communities to help them thrive as we go forward.
Wow. I think about this just from like a personal perspective, and it's like, yeah, why didn't this exist before, you know? And so I'm curious if you all could speak to, you've made it sound easy, and I presume it wasn't. So why is it so hard? Like, why would it take until now to make this program possible for our residents?
Who wants to start?
Okay, who goes first? Let's
go ahead, Amy, you start.
Yeah, I think I would say three things: funding, technology, and like capacity. So I think there's more than that, but those are the three things. You know, to be able to have a system that there's no perfect system. You know, there's no perfect system that's both a wonderful case management system and also then links with other agencies. And because each entity has often solved their problem of how to track in a different way, everyone has different systems, different processes, different practices. So it really started with, you know, multiple years ago, bringing those partners together. William was there from the YMCA, you know, bringing partners together to say, hey, let's agree that we really need to solve this problem. The problem being a disjointed navigation system for our region. So having the technology, figuring out how do staff not have to duplicate those efforts, and have it be a streamlined process so no one's entering things 3 different times in 3 different ways. Funding, usually systems cost a lot of money, right? And, you know, both for the startup, but also the maintenance, so that we made sure that it was going to be most beneficial if it wasn't only large organizations like health departments and health systems, but nonprofit community organizations like the Y, like the food pantries, you know, like after school programs, for example, and that they wouldn't, it would be difficult to sustain that if there was a large cost. And then the third one is capacity. Takes a lot of, to really do this well, our aim is to have strategy, to have metrics, to have outcomes, to really be able to document that we're doing something that's helpful over time. We're doing something that's actually making a difference, and, you know, it has improved health outcomes for our community. And so that takes capacity, which I think is why we've done it together. What else would y'all add?
I mean, I think you have to see COVID for all the negative that it is, for some of the positives that it has brought to us. And some of that is every organization is to put aside their own needs, their own desires, to really focus on how do we move through this crisis situation. And if we stop long enough to take advantage of that for the long term and see the partnerships that we've been able to build out of necessity during this pandemic crisis, and see the potential if we were able to stick with that and grow that instead of just going back and doing the work that we've done. I think that's one. People are just looking at the world differently because of what we've been through. And so let's leverage that moment. But I think also the idea that this is not, you've heard us all talking about doing this work for many years together, so none of this is new. But it has been highlighted for the community at large in a new and a different way. And so we've seen the municipalities come around this in a new way, not that they weren't funding it and doing it differently, but really looking for holistic answers versus individual programmatic pieces to it. I think you're seeing communities understand how we need to not be duplicating services, but leveraging, and we just have more people that need those services. And I think those are some of the opportunities we're trying to take advantage of in this moment to try to make this work more holistic.
The only thing that I would add to what Amy and Abby have shared is that this provided an opportunity to really define the common goal while we have talked amongst various community partners about the need to develop a cohesive system or mechanism for collecting and sharing data. We did not have the common goal that was truly outlined. And I've heard several times throughout this 20 some months of the pandemic that you should never waste a crisis. And so I do believe that one of the wonderful things that has come out of this pandemic was the need to focus on addressing the immediate needs of populations that many organizations from a singular standpoint have been trying to do on their own, or gathering small groups to talk. And what has happened truly throughout the pandemic, as Abby mentioned earlier, is that we have really seen the light being shown on many of the disparities that have existed for years, and enhance the level of urgency to really come together, leverage our assets, our brain power to really address problems that we've sort of touched on over the years in pockets. And one of the things that has been very educational for me throughout this is that the process is just as important as the product. And we have learned so much by bringing together partners who truly have the same goal in mind. I'm just not quite sure if we had all articulated it the same way. And this pandemic has given us an opportunity to do so.
Wow. I think about, the purpose of this Better Together series, as I said in the intro, is really to shine a light on these, efforts that are underway in our community. And I use that word not lightly, it is effort, right? I think for many reasons, as Amy and Abby and Cheryl have outlined, there's a reason things have happened the way that they have in the past. And certainly I hear you, and I hear you say that you take advantage of the crisis, but it was an effort, I presume, even still, particularly building relationships maybe, and building trust among organizations when you couldn't even be in the same room with one another in many instances. So I'm interested to know about some of those lessons that were learned, and maybe a challenge or two that you faced that in hindsight, maybe you would have dealt with a little bit. And we're just all friends here, so feel free to be up. But just curious about kind of those lessons learned, if you could look back and think about something that you might have wished had gone differently, or maybe there was a blessing in how it did end up.
I'd like to start with that one because I think both Amy and Abby should get counseling degrees after all the phone calls that we've had. I'll tell you one of the critical factors or challenges, and then actually has turned into a huge blessing, was the importance of patience. And one of my colleagues shared with me a long time ago that often it's important to give folks grace and space in order to work through issues. And coming from an academic health center, believe it or not, we often do see the urgency in issues and feel the need to move, outline an issue and just solve it. And one of the critical lessons for me was to think about all of the multiple entities and all of the major agendas that needed to line up in order to support us moving in the same direction. And I think Amy mentioned this earlier, that it was really important for different organizations to think about what their role was in this conversation, and then how it contributed to the greater good. And so patience was one of the outcomes of this that I think has been a calming force to help us all to stay focused on the ultimate goal.
I'm happy. Oh, no, Abby. All right, I'm happy to go next. Martha, you said the word trust, and that's what came to mind for me. So yes, Abby and Cheryl and I separately, together, collectively, in the morning, at night, on the weekend, text message here, phone call here, can I grab you real quick? But that was born out of a trust that existed between the three of us and between folks on our team, knowing that we did share this goal. And I think it's kind of married with, you just said, Cheryl, the greater good, right? The focus being not that everything that I want and all of my needs being met for this, but we really are, have a shared mission in doing this together. So again, want to thank the two of you, but that trust that built, Cheryl, over a lot of years. Abby, trust in a pandemic built real quick. Pretty immediate. And then I think, the other thing, as I mentioned, like seeing the greater good, there was no perfect system, no perfect process. Every entity probably would have designed it differently. So I think we had to actively lay down some of the things we were hoping for, some of the ways we wanted it to look, in order to say, hey, our whole goal here is a streamlined navigation system and process that we do together. So that means we won't get the whole thing we want, but we're really going to focus on the end goal here. I don't know that there was much we could have done differently from a health district, other than we didn't have very much capacity either. So I think part of the processing was, okay, how much can we be involved in this, and how much do we need to phone a friend and say, hey, we really need help here. And then I think the last thing too is just looking at the whole region, not just looking at our piece of the puzzle, the academic, the nonprofit, the public sector, but really saying, how do we do this approach from a region here and doing it together?
Yeah, again, I think for me, I came in as CEO a year ago, and, I saw kind of what I thought was an opportunity that I wanted to grab a hold on as a new leader. And for me, it was a little bit of slowing down kind of to the patience thing, because I was ready to make something happen and honor kind of the work that had gone before, that we were learning about in the middle of that process was part of it for me, right? Like there's a lot of effort that have gone in underlying, and I was learning that as we went, with a vision of where I thought we could be if we would all join arms and make this happen. And so the combination of that, I think some of that kind of like drive was good to keep it moving at certain points in time when it seemed like, wow, this is hard and we're going to have to start over again. But some of it was for me to kind of say, okay, there's a lot of things that have gone before me, and it's not about me or my organization or what we're trying to do. And how do we honor all of that other work and make sure that we're wrapping it up into this, so that we are taking advantage of all of the thought processes that have come before. Would we have done it different? I don't know. I think there's good and bad in how we all went about it, but I think that's what made this team good, is that we all brought a different piece to it. The drive to say, no, we're going to just keep moving and try to make it happen. And Cheryl, who said, let's stop and think about where we've been before and how we got here, because that's important. And just the combination of all of those different pieces is what has made a really rich opportunity for us to go forward and to make something better than any one of us could have made it on our own. I don't think you could have done this on any one of us individually, but the fact that we're here and really pouring into this project is going to make it a richer opportunity for the end product as we go forward. And I think there's a commitment to do that work and to say, no, it's hard, but let's start over again. And there's been a number of those times when it's felt like, wow, that seems to be the block we're not going to get over that. And somebody at different moments in time was able to step back up and say, no, we can do this. Let's keep going. And that's been allowing each one of us to kind of pick back up and say, all right, I'm with you. We're going to continue to do this. Let's lock arms again and keep going. And you need that, because you can't all keep that marathon going by yourself all the time, it feels like, in that partnership.
So just really practically speaking, what has this effort meant to families in the region? Do you have any kind of insight on?
Yeah, so let me break down a couple of the numbers and you guys can jump in, but I came prepared for a little bit of that just to be able to talk about it. We've been able to, this year, there have been more than 7,000 unique users that have come to Help PlanRVA to be able to try to help and get services through that. We have over 2,000 public-facing organizations that are part of this, that we're able to connect people back through then. So I like to think about it as, not only is it helping us do our work, but we're really helping the infrastructure of human services in the Richmond region, helping all of those different organizations do their work better too, because we're connecting people to services that they have that may not know that they're there, so that they can do their work and provide their services and fulfill their mission as well. We've had a total referral since January 1 of this year for 724 different families from our social needs navigators that have been able to help then connect them and then follow up to ensure that those services have been done. And since January 1, total Help PlanRVA searches have been over 16,000. 48% of those have been in the areas of workforce development, childcare, and housing, right? It's really specific things that are core to helping families thrive or the services that they're looking for, not kind of tangential types of things. And so that's been really, as everybody is facing renewed challenges in this area, like how do we really help families get back to thriving through this crisis? And then how do we build those services for the long term so that we can create that stability moving forward? So for us, those are just some of the numbers. Housing has been 34% of the searches that we've had. Food is 20% of them, right? So housing and food are really core to families and just that basic needs that we're trying to help connect people back to. So I don't know, Cheryl and Amy, if you have any other things that you would add to that. That's just some of the data, right? That shows really kind of where those services are having and the scope of what we've been able to do.
Sure. What is the geographic scope? I'm sorry.
So it is kind of in the metro area, right? As we go, I don't have the breakdown of kind of where everybody's coming from, but it is a mix of all of the different areas: Chesterfield, Henrico, Hanover, the city of Richmond. It's a broad region that we've been serving through that service.
Amy, I think I interrupted you.
Yeah.
Sorry.
No, you're fine. Any other questions? Yeah. It has both, Help PlanRVA, an individual can search, can go online, search something that they need. And then there's the back end kind of case management component, if that's helpful for an individual. So for our teams, we have teams doing outreach in communities regularly. And then we've got social workers who are doing navigation. Maybe it's related to COVID, maybe it's related to you're pregnant, whatever that may be. And so I think it both allows people to have a website to look whenever they're ready. 10 o'clock at night, they might need to search something, they can do that. But then it also adds for the more in-depth kind of case management and navigation support from our teams as well, to be able to track and follow up. And particularly, as I've mentioned, we have a couple of we have health workers and navigators and nurses, and that way we're not duplicating efforts. We can make sure that we're tracking that one person and where we've sent them and where they've gone, kind of using one system. So I think, making it an easier approach so we don't have to ask people the same questions over and over again, and then, having it both be a system where someone can go on themselves, and then, a system if needed for more in-depth support.
And I think that no wrong door approach is really important, right? And so that when you have these issues, you're not having to tell your story 10 times, right? Because the case management system, when they come to us, if they're referred to us by the health department or by VCU, we can see their story, we can see why they're there and fill in the specific details we might need, but not ask them to repeat everything all over again. And that's really helpful for families who are in crisis. They feel supported and seen at that point more than just, and now I'm going to do it all over again.
I'm going to add one more, unless Cheryl, you had something else said, but I was just going to add, we are early in this system, right? So Abby can say, data from the last year or so, but we're really excited to build out, what data and what outcomes we can track. So there's certainly referrals and how many people actually get connected, but there's some more in-depth analysis that we can do too, just to really understand our community better, understand where the gaps are in resources and how we can work on that. So I think we'll continue to pay attention to that in the months to come.
That was perfect. My next question was going to be, what are you looking forward to in this? So yeah, it's a great point. How do you think that this information that you're collecting in service to members in need can help inform, service delivery systems in the future?
So I'll jump in here because I think that one of the things we know is that programs have built partnerships over the years, and that referrals have been made on behalf of community partners from one entity to another, as well as individuals have gone looking for services. What we're hoping is that we can create a cohesive network of partners, as well as a system, a tool that is both driven by people and technology, that consistently connects individuals to address the gaps and the needs that they've identified, but then allow agencies and organizations to communicate so that individuals can receive the services that they need. And as Amy mentioned, not have to tell their story over and over again. Because in order to really move us towards being a community where people are thriving and as healthy as they can be, we have to figure out different ways to communicate, to share information, and to build the trust of the individuals that we're supporting so that they know that we've got them and they're not falling between the cracks that may have existed in the past just because our organizations have different names, different boards, but our ultimate goal is to support them and their families.
And I think here at the Y, we're talking about trying to be a holistic health and wellness partner for families, right? So if you're coming to us with a food insecurity issue, there are other things that you might have too, right? And can we in one swoop in the conversation with a navigator understand that you might have food insecurity, but do you have access to childcare? Because we could help you try to find access to childcare. And do you have, a clinic where you can take your kids to get vaccinated, whether that's COVID or other kinds of vaccinations, right? Like we can help support them in a holistic way. That doesn't mean they're making this one phone call to solve this problem, but we can help them solve multiple problems that they may not even understand that we can help them do. But how do we create that understanding to support them in a broader perspective to really then help that thriving opportunity that we're looking for them as we go? And so that's what we're trying to do. And it could look like a lot of different things. And I think each one of our organization, we know we have our lane. We know the things we do really well. We're not trying to be all things to all people, but if we're doing this together, we can ensure that we're leveraging all of the resources our community has built. We have a really amazingly philanthropic community with nonprofits that have services across the board for what families might need. But if families don't know how to access it, they don't know they're there, then we're not using them to the greatest extent that we can. So this is really an opportunity for us to create that social fabric and that net, and then leverage that net to the greatest possibility as we go forward, if we can engage all of those partners together to do this work.
So with mentioning that there are 2,000 partners in this effort already, for that one partner out there that still exists that isn't tuned in, how could they get involved? What steps could we tell them today to get connected into this fabric?
Yeah, so I think that you can call the YMCA, and we have our community health partner program with navigators or our community health VP and other groups that are working with them, that we would love to connect you into that. So that would be one way you could contact us here. You could send us a message through the Help PlanRVA because we're tracking that, or as another way we could do that. But we would love to have conversations about what that looks like to be part of this network and to have your resources available for us to be connecting to as well. It's a big piece of where we're going, and the future of this is to be able to build that network in the Help PlanRVA system so that we can do more work together.
Awesome, thank you. And I'll say from a geographic perspective, is there room to grow? Is it sort of limited by a geographic footprint, or is it dependent upon how those partners and the geographies that the partners serve?
Yeah. Amy, you want to take that one kind of from the health department's perspective?
Yeah, sure. I think Help PlanRVA, of course, is focused around the Richmond region. It's Help PlanRVA, but there is a statewide initiative around using the same system called Unite VA. So there is, I think, lots of different angles here through the hospital systems, through the health department, through other state entities to try to say, hey, if everyone kind of rolls this out in a strategic way, we really can coordinate across jurisdictions, across entities, across agencies, because we know our community, they live and they work and they play and they move sometimes and job switch, so ideal scenarios that we really do come together as a state. So there is a statewide initiative. I think we've chosen to really say, how do we nuance this and really think about what will work and flourish here in RVA?
That's awesome. Thank you. So I had one other prepared question that I think you all have, and it's sort of going back to this kind of lessons learned and thinking in retrospect. And I'm just interested from an organizational perspective, and you've touched on this a little bit, but how do you think whether it's the patience that was required or, the ability to sort of think differently about how your organization operates. How do you think those lessons or behaviors move forward into the next crisis, let's say? And do you think that this is a one-time phenomenon, or has it been able to set sort of maybe some structural things in a new trajectory here in our region?
So I'll say for us, I think it's about centering families and putting that at the front, not our priorities, not our organization or kind of where we've been. But if we're centering kids and families in the center of how we're going to serve them and how do we do that work better, whether we are going to do that work or other partners are going to do that work, that's really kind of the place where I think we all have to start from. Is that's what we're here to do. We're here to serve our community as a nonprofit organization, as a health system, as the health department, and all the other partners that we have at the space. And so if we're doing that, then it's about how we do that work best, whether it's this crisis or the next crisis, or just building better processes in a normal time. And so for me, that's what I hope our organization is going to do, is to continue to center that kids and families as one. And then I think it is the infrastructure, right? It has taken infrastructure and commitment to building that infrastructure here in our organization to get after this. People, it is always about people, and people take salaries and time and space and all of those other things. And so for us to really commit to build that infrastructure and to have partners come around us as a nonprofit organization that is looking for multiple ways, whether that is through grants or philanthropy or other opportunities to try to resource this work, it's going to be an important part about the future that we're going to continue to look creatively at how we're going to do that resourcing.
I think there's significant lessons that each of our organizations has learned through this process, and of particular importance for our health system is being very clear and acknowledging that there are things that we should not do and could not do, even if we had all the resources in the world, because it's not our area of expertise. But if we're serious about adopting and embracing the strategy of being patient-centered, which is the health lingo for what Abby just described about putting the client and the family in the center and first, then it is important for us to think outside of our walls and to begin to identify and respect and acknowledge the expertise of the community partners that we need to continue to build strong relationships with, because we need each other. And it is important for us to figure out what can we bring to the table to move our common goal towards truly being successful, but at the same time, also figuring out how we can lift our partners up so that they can be as successful as they can be. It truly is an all-in effort on everyone's part, but we have to understand that we don't always need to lead. It's important to be in the room, to hear the conversation and figure out what can we contribute.
All right, I'll try to summarize our last year and a half, everything we've learned. No, I'll just pick a few things. But I think it goes back to both, the organizational mission I mentioned in the beginning, to expose and address the root causes of health disparities while ensuring we build health equity and partner with our communities. We saw that in the middle of COVID, and we're seeing that now. And I think at the core of that is having a shared goal, like we talked about on this, on this group of what we did here. When our goal was vaccinating our community together in January and February and March, we were able to bring together partners, different entities, different agencies, because we were in it together. I'll never forget leading a provider phone call, and I didn't know the surgeon, but he was there. He was clearly ready for surgery. He took his mask down on our Zoom and he said, "We're in it with you." I'm like, yes, we're in it. Okay, we're doing this. Woo! Okay, here we go. And I just think that sense of when we have shared mission together, we're able to say, okay, it's not what I want first. And we're able to say sometimes that means we give up power. We let other people decide. We have resident voice at the table to be able to do that. So I think that's the biggest thing that we want to continue to do as public health, raise up really important issues. The city of Richmond now has a resolution that racism is a public health crisis. We want to be at the table for that. We want to be playing our chief health strategist role to say, okay, what does it mean to have a shared focus on this and really address this and name these things for our community? And that means we got to get in deep. That means we got to roll up our sleeves and say, okay, how do we do this in a different way, but do it together?
I just have to take a moment and say, I think that so much of what you all have talked about today are thematically things that we've heard about for a long time, putting people at the center of our work, trust and patience and, really focusing on how to dismantle those inequities that exist in our community. But listening to the three of you talk today, it's undeniable that this is exemplary of those principles. And it really, I just have to remark and say, thank you for the work that you've done and the work of all the partners, because I know it's many, many people that stand behind the three of you, but it's really exciting to know about really, frankly, where Richmond can lead, because I think that that's also one thing that I'm hearing here. This isn't ground that other communities have really tread, and we're blazing the trail for other communities to follow in Richmond's footsteps, and that's to be commendable. And I just wanted to say thank you to each of you for that. We had a question that came in from the group, and I'll take a moment to encourage others that are watching to send in their questions. We're about at that time. And so one of the things, Abby, you had mentioned earlier was around individuals reaching out from zip codes that maybe listeners might not expect. Just kind of curious what maybe some common misperceptions people have about those needing support in our region, where we think of those communities actually existing, and how can maybe the data that we're generating from this be able to tell a clearer story about the range of need and the diversity of that need across the communities.
If I can get it off mute. Thank you. No, and I think that is definitely true. And I think, we know that there are certain areas of our region where we have more concentrated poverty. The city of Richmond obviously has, issues in that in different parts of the city. But what we know is that as the community continues to grow, and we have more and more people coming into the community, and people are becoming more transient, that those needs are spreading out, and that they're in lots of different places. We see it at the Y across our footprint, in our income-based rate scales that we have, and our membership and our programs. That need does not exist in one part of our community. It exists across the footprint. So I think we think that it's concentrated in certain parts, and what we need to understand is that there are families living next to you that have needs. You may not know it, you may not see it. There are kids that that go to school with your kids that have food insecurity, that their parents may not know where rent's coming from next week, and we're seeing that as it comes. So I think as we are able to collect more of this data and understand who is reaching out and what that looks like, we can start to take down some of those barriers of communication and understanding about where the need is, but we can also start to highlight and then focus where we need more support from local nonprofits that may be focused in one area of our region and not in others, and expand the footprint of services potentially, and to understand, how do we help support in a different way? How do our local governments understand where those needs are that maybe they don't see on an ongoing basis, but they're there and they're growing? And so how do we serve in a more holistic way as we go forward? And I think that's the general kind of misconception, is that it is only in certain parts of our region and not kind of across the board as we go out. And COVID has only highlighted and made that an even greater opportunity, because there's families all over that have not been able to survive and come through this. So many are lost jobs, don't have access. Somebody's had to quit their job because they had to stay home with kids during virtual learning. And you just don't know what that has done to their particular situation, and how do we help support them during this time.
Thanks, Abby. Appreciate that. Just curious also, another question came in from Andrew, just asking, what can the average Richmond resident do to support the mission of health equity? And I I love that question so much, because I think about so many things that have become a part of discussion in our community in the wake of COVID. And so as leaders and practitioners, what would you offer to just a person who wants to get involved?
I'll start with just educating yourself. I love what Abby just shared about the understanding what's going on in your community. There is a wealth of publicly available data around some of the areas that are of concern, around educational attainment, around poverty levels, issues with housing. I think one of the things that's great about this region is we have lots of data that's been gathered and lots of studies that have been done. And so if there's a particular area of interest, just do some research. That's the beauty of the internet. You can find almost anything at any time of the day about any area. And when you start to dig into what is happening in the greater Richmond area, it truly may surprise you. I know that as long as I've been in the field of healthcare, just the exposure in the past couple of years to some of the information related to social and economic issues has just been enlightening and really helped me to have conversations with folks about where are the opportunities to really align things that I have done in the past and want to do in the future with initiatives that they're interested in. So educating yourself, really being open-minded, and then understanding what does it mean when you identify health disparities or inequities. Then it doesn't mean that we move into a sympathy, along a sympathy path. It means we need to move into an action mode. And there's a lot of work that's being done. And it's just a matter of going and finding it out. And if you want to just start someplace, I'm going to offer up the YMCA because Abby's team has been so great in really providing information to folks who just want to know what is going on. And I would start with just Google Help PlanRVA, and it'll give you some great information.
Yeah, I'll add two things, just building off what Cheryl said, and a comment about understanding our history. We had to do that with our navigation work, but I think that's so important in Richmond. There's a lot of good books. One of them is Richmond's Unhealed History by Ben Campbell. It's really deep, it's really intense, so get ready. But it does cover actually the 1600s till about late 1990s. And just really helps understand why were highways built where they are, why are there public housing where there is, what happened to particular communities, particularly African-American communities in our city and in our area. And I think that just really helps, it has helped me, start from a place of understanding and start from a place of asking questions to try to find out more information based on that. The second thing I'd say is, again, building off Cheryl and Abby, know your neighbors, get to know folks who are different than you, have conversations, ask questions, tell your story, hear their story. And that's been really instrumental for me. Both my own neighbors, also our community health workers at the health district have been some of my greatest teachers in my own race and culture journey. And then the third thing I'll say is volunteer. We got a medical reserve corps at the health district. We couldn't have done our huge pandemic response without the hundreds and hundreds and hundreds of medical reserve corps folks who have volunteered over and over again. So you could just Google Medical Reserve Corps, Richmond Health District, and we'll get you connected there. So MRC Medical Reserve Corps.
Excellent. Thank you all so much. My last question for you, because if you can believe it or not, the hour has almost gone. It's just incredible to hear you all talk about this, but a lot of today has been about kind of looking back and talking about the effort to date and that kind of thing. And I'm just curious in the last few moments if each of you might be willing to share. What do you think we need to keep an eye on for the future? Where are those emerging needs and what kinds of things should we, listening at home, community members, community leaders, should we be thinking about as we look to kind of the post-pandemic world and how we should be positioning our communities to be from a position of strength and not peril. That's a tough one, and one I didn't send to you beforehand, so I apologize.
So I think it's about community and building community, right? Like it's all going to come down to relationships, as you know, we kind of all have indicated here, understanding who you're sitting next to, having the curiosity to start to understand more about our community. We're going to be better together, as your podcast is called, right? Like, I mean, but I think that's true. None of us are going to be able to solve these problems. I think our local governments are going to be better together. You know, what is one thing that we think the region needs to do? I think the region gets a bad rap sometimes on how we work together, and sometimes we could probably do it better. But I think continuing to build that capacity to think of ourselves as a region and not individual counties and cities will help us serve families. They're transient. People are moving back and forth across these lines. And if we can understand how to connect them in a way where we're not losing track of where they are, I think that's an opportunity for us to serve better and more consistently as we go. But that takes trusting our partners and having relationships with each other. You know, when, you know, Amy's thinking I'm not getting my job done, we have a relationship. She can call me and say, Abby, what's going on? Like, pick it up. Let's do this. Right. And we respond in that way, but that only comes because of a relationship. So how are we continuing to build trust, build relationships, have an open mind and an open heart for what it really means to center kids and families? I think that's what's ahead of us. And, you know, if we continue to do those things, I think the opportunities will continue to present themselves on how we can move this region forward and be the best that we could be.
Beautiful. I couldn't have thought of just a more inspiring message to wrap up our webinar today. Ladies, thank you so much for the work that you do in our community. It's a shame that it's taken this long to get you on our webinar, but we're so grateful for your time today and look forward to having you again to talk about the other new and exciting things that you have in store for the community. I'll say thanks to all that are listening. Just as a reminder, we do host our Better Together webinar every third Thursday of the month at 2 o'clock. Live streamed on YouTube as well as accessible through the Zoom webinar platform. So if you're interested in a topic, if you have a suggestion for a topic that you think that we should cover that you're a part of, we would love to be able to shine a light on that. As I said, this is really an opportunity to be able to put back into the community examples of collaboration and good work that's happening. So again, I'll say thank you to our panelists and thank you to our listeners today, and hope everyone has a wonderful new year, and we'll see you again in 2022. Thank you.
Thank you, everyone.
Awesome. Thanks for having me.
Thanks, guys. Appreciate it.
Thank you.